Hey there, my name is Ganiat. I'm a therapist and I am here to tell you 10 very important and unfortunate reasons why therapy fails. Now, this is going to be a series, so make sure you watch every video. That way you can get all of the 10 concepts that we're about to talk about. Number one, you really just did not connect with this therapist. There's something about this therapist that just doesn't sit well with you. You know, in some other services, you rely on their degree, you rely on their experience, but therapy is different. That therapeutic relationship is crucial. And in the first few sessions, if it's not built and if it's just not clicking, it's really difficult moving forward from there on for the therapeutic relationship to improve. As a client, if you're trying to get into therapy, you have to go with your instinct on this one. If something about that therapist just does not click with you in the first few sessions, talk to them about it and potentially look for another one. Another way that we can go about it is you can talk to the therapist about it instead of just ghosting, right? And they can be able to adjust accordingly and move forward, but make sure you say something. It doesn't work if you stay with the same therapist for 6 months that you really don't like and you agonize to get into therapy every time you have an appointment. That is just not what we're here for. So it's really important to build that rapport from the jump, and that is the first reason why therapy fails. Number two, unrealistic expectations. Unfortunately, this applies to both. It's not just the client having some unrealistic expectation of the process. It is also about the therapists themselves having unrealistic expectation of this client. Let me explain. So you're a client, you're looking for a therapist, but you're looking for a therapist because your marriage is about to fail, you're about to flunk out of college, you are about to have a baby, and you think you're just going to be a terrible dad or mom. You're looking for a therapist to make sure that this doesn't happen. Okay, that expectation seems reasonable. You just want to be a better person so that you don't do this stuff or these bad things don't happen in your life. Here's the problem with that kind of expectation. You're going into a therapy session, not a solution-focused session. What I mean by that is we offer clinical services where it is traditional therapy using very important and evidence-based type of modality. That's traditional counseling and therapy process. It does take a little bit of time. We're talking about between 3 months to 18 months for most folks. And if there's trauma involved, it might even be a little bit longer and more persistent. That said, we also have the brief kind of counseling where it's issue focused, right? You're coming here because you're trying to switch jobs and you want to weigh your option before you accept that offer. That is not necessarily a counseling session, right? That is a solution focused session. This is a problem solving session, right? Is a design thinking session where you can get with this one problem and just kind of figure it out, come up with a very actionable plan within that 60 to 90 minutes period, and you're on your way. If you're looking for traditional therapy, that is not particularly how that process works. So when your expectation is to make sure that you don't flunk out of college, however, it is already past midterms, it is already past addendum period, you already have 2 F's as it is, it's going to be really hard to change that into a W or to even proceed with the class and finish the semester strong. Also, you want to make sure when you have the child, you don't continue the toxic, generational dysfunction. That's great, but if you're already 6 months pregnant, I don't think that's doable in 3 months, right? It's just scratching the surface at that point. Starting is important, but it is also important to have those goals that are realistic. I encourage you to be just curious about the process. Know what you want from it for sure, but be curious about how the process is going to play out instead of feeling defeated session number 3 that you still are popping off or you are still out here gambling and you kind of want that to change right away. So that's from the client's point of view. The other part of that is from the therapist. Unfortunately, fortunately and unfortunately, therapists are also human. And what I do when we work with interns is to make sure that when you're looking at the paperwork that this client has completed online, what you don't want to do is look at the paperwork and have these preconceived notions before you meet the client. Let me explain. You have a client that has completed the paperwork and you're reading through it before the session, and this client has a PhD degree. They are at the top of their profession. They are doing well for themselves. Everything seems fine on that level. But they have, some bad habits. They need to work on their assertive skill or communication skills, or they just stay in this persistent depressive episode. But you're focused on creating some kind of identity for them before you even meet them. So if as a therapist, you already look at this person on paper and you're going in full throttle with CBT, you might find yourself disappointed because you have this unrealistic expectation where what you should do is plan to meet the client, see where they are, assess what's going on, and then decide accordingly in what series you're going to use what modality. As a therapist, you should be making that decision as you go along in each session, not necessarily have it all written out and planned out, because then you're setting yourself up as a professional and, unfortunately, and most importantly, the client up for failure in that process. The third reason why therapy fails for some is just because people are so resistant to change. And hear me out. I'm not saying that they're stubborn or nonchalant. Clearly, they want to change. They started this process because they are trying to change, okay? If change was so easy, right, we will not have a whole profession that is dedicated to helping people change and improve their lives. Okay, that said though, sometimes when clients come to counseling, we have spent a few sessions understanding their emotional presentation, understanding their trauma, understanding their challenges, understanding their areas of strength, right? And then we get to the part where we now understand what's going on. Let's create a plan that will help us improve your life. Okay, now that is where some clients tend to buck a little bit. The reason I say that is, if you're working with a 40-something-year-old or a 30-something-year-old person who has been doing the same thing over and over again, even though you are the professional, you have to be okay as a therapist to realize that change is a rather challenging process, especially when it's coming from someone who is just really getting to know a client. So what happens is the client does not want to change in that moment because maybe you're just asking for a lot of them, or a lot from them, to put it in a clear perspective, right? For example, the client is doing this thing where they go hard and they hyper focus for 6 weeks, and they're doing all the things, they're checking off all the boxes and doing what they're supposed to be doing, house clean, everything is good, and then they crash. They have that moment of depression. And now his life is trash, nothing is working, it's just in a very depressive episode. Okay, as a therapist, you have to understand that is part of the process, right? Okay, well, but as a client too, I can see how in that moment, if somebody is trying to tell you what else you need to do, you really don't want to be bothered with it. You don't want to do it. You really don't. Now, keep in mind, when I say resistant to change, I'm not talking about addictions here. That's a whole different topic for another video. I'm just talking about changing everyday routine, processes, jobs, and whatever the case may be, whatever the plan is in counseling. Someone might be finding it difficult or resistant to the change that you are proposing, partly because they really just don't want to do it at that time. They have not seen the value of or the purpose in the change that you're proposing. And to be honest, as painful as it may be for some clients, they're really just comfortable with it. They're comfortable with how they are, but also uncomfortable at the same time. So if you would step aside for a second and you look at it from that point of view, you'll understand that this resistance to change, we see it. Most therapists, most trained therapists, see resistance to change as a part of the therapeutic process. But therapy fails because of it If the client is really just not ready for that change, there is nothing a therapist can do that can get the client to be ready for change. Remember, seeking therapeutic services is a personal and voluntary choice that a client can make. As a clinician myself, I always tell my client that it is in fact a privilege for me to be part of their growth process. I see it as a privilege, and I take that privilege very seriously because it is voluntary. It is not mandatory. I can give them all the reasons I can muster to encourage them and give it meaning for them. But at the end of the day, the client needs to be ready for that change, and that is something that is outside of anybody else's control.